So my question to Ruth, just hearing some of the points that Ahmed raised on the importance of community engagement, broad mobilization, and governments rethinking their framework, and the lessons learned from polio, particularly some of the efforts that were driven by communities. So my question is, in Kenya, the government has started to allocate more resources towards community engagement, specifically a COVID response. What brought on this thinking? Why did the government and other stakeholders in the Ministry of Health decide that community engagement is important? What has gone well? And if you don't mind, also share some of the challenges. Over to you, Ruth.
Thank you very much, Lalem. And taking over from where Ahmed has left, I think he has said much of what I would have wanted to say. But I think he has brought in some very good key points about community engagement, because he says that for us to be able to work and to be able to deliver, we have to engage the communities. And this is drawn from the polio eradication. And he talked about the communities' trust for governments. And that means that for governments to be able to work and deliver, then they have to gather the trusts of the communities. The only way to gather the community trust is working with them. So in Kenya, I think some of the things that we've learned, and I don't think it is only Kenya, but globally, is that for any intervention to work, community engagement is very important, because they understand their problems and they're the best placed people to advise on the solutions that can work for them. And when it comes to COVID, interestingly, you realize that most of the control measures are community-based. When we are talking about restriction of movement, wearing face masks, practicing social distancing, and proper hand hygiene, all those things are things that are done at the community level. So if we have really to be actually succeed in the control measures, then we really need to involve the communities and get to have them buy in this. At the beginning, what we experience in Kenya is that community engagement and community response is not something that the government at the very beginning prioritized. And what that meant is that we didn't bring in the voices of the community at the table when we are drawing the response. And the effect of the same was that we had some challenges, and the support of the communities was not as envisioned by the government, because it was top-down approach other than the bottom-up approach, where you involve the communities and then they inform what kind of interventions that they think can work for them. As a community implementer in Kenya, we felt that we needed to work with like-minded partners to bring the voices of the community to the table. And that is when we worked with the government and advocated for inclusion of a community engagement committee within the larger committee that was working for the COVID response. And with that, we had several committees, subcommittees working on various documents and mobilizing the various stakeholders to make sure that the voices of the communities are engaged and are brought to the table. One of the successful things that we did was actually to help fundraise, and more so to push the government, if I may use that word, to allocate some finances towards COVID response. And this is more so the county governments, because as you are aware, in Kenya, health is a devolved function, and more so the community component is devolved. And we saw a very good gesture, because out of the support that we offered working with the relevant department in the Ministry of Health, we had some reallocation of funding that actually was earmarked for community response. And that is the first time that we started having and seeing some few things, investments in community health, like PPs for community health. And that way, we have seen that there has been a lot of support coming from the communities. I'll give you an example like what Ahmed have said. We realized that in Kenya, mothers were not going to deliver in the health facilities. Children were not going for immunization. We lost like 20,000 children who were supposed to go for immunization, but they could not go because of the stigma that was associated with getting services from the health facilities. So what is happening now is that the communities with proper PPEs have been able to go back to the households and convince the mothers to go for their ANC clinics, convince and track the defaulters for immunization, something that cannot happen unless we have the communities on board. And now that brings me to the aspect of when we are dealing with the community, we have the gatekeepers at the community, and those are the community health workers. And for the longest time, we have seen reluctance from the government to allocate resources towards financing community interventions. But when they realize the impact of having community health workers support the interventions and the response, I am happy to report that we have seen a county government coming up and allocating some resources. We can count several counties that have now agreed to pay some stipend to the community health workers. They are bringing, they have some plans that are geared towards community interventions. And this has really worked well in some of the counties that have really agreed to take up this. The other thing is that you have also seen an interest in the national government to put in place policies that will ensure that we are institutionalizing community health. And one of them is coming up with the community health bill. It is only, we are one of the few countries that have not institutionalized this in a law, and we are hoping that this will be done. And this could not have been, could not have happened were it not for the support that the like-minded partners that you are part of have engaged with the government. And advocacy has become very key in making sure that we are supporting the government and we are bringing the voice of the communities to the table. On the next steps, we are working with the Ministry of Health now to define the strong metrics that will foster accountability, because we have seen a lot of funding coming to the community level, but now the other aspect is how do we hold governments accountable for the funds that they have brought. So that is the next step, and that is what now we are working with the partners and the government to make sure that we are holding each other accountable, because also as partners, you also have some of this funding. And I think Ahmed also brought in a point of partner coordination, because one of the other things that you have learned within this COVID response is that there have been a lot of duplication. So how do we coordinate these efforts and also hold each other accountable, and more so the government, for the funds that have been allocated? I think that is what I would say. That's it from my end. Thank you.
Thank you. Thank you, Ruth. And I see in the chat there, there's been appreciation for your statement and for your emphasizing the role of community health workers.